In rural western Kenya, a team of trained female motorcycle riders is helping expectant mothers reach clinics and hospitals more quickly. Known as the BODA Girls, they are part of a community-based health initiative designed to overcome one of the most persistent but often overlooked barriers to maternal care: reliable transport. Here's a report.
The roar of engines carries along the dirt roads of Siaya County as a convoy of motorbikes moves through rural villages. Their riders wear bright pink scrubs and helmets, standing out in a landscape where reliable health transport has long been hard to find. These are the BODA Girls. They're female motorcycle riders trained not only in driving, but also in basic maternal health and patient care. Many of them are nurses or community health workers.
There's a gap in transport. And as we all know, that access to transport is one of the major overlooked aspects on women's health and economic empowerment, especially in the rural areas where the distance and the cost are the barriers to access to health.
Their job is to make sure pregnant women living in remote areas get to health facilities for checkups, scans, or deliveries free of charge. The service has been running since 2022 in Siaya, Kisumu, and Homa Bay counties. It was set up by the Matibabu and Tiba Foundations in response to an urgent need. In many areas, women struggle to afford public transport or simply have no way of reaching hospital in time. The consequences can be fatal.
It has been a challenge for me to afford bus fare to get to the clinic. If I can't make the trip, I miss my appointment and have to reschedule for another day. Fortunately, it has become easier. I simply book an appointment with a BODA girl who calls me on the day I need to go for my clinic session. She comes to pick me up, takes me to the clinic, and then brings me back home.
Basically, we had gaps in accessing the facility, affordability, and also just the women accepting care, hospital care or healthcare services. Yes, so the complications that would arise most is that mothers could actually die due to postpartum hemorrhage, excessive bleeding at home after delivery. Some women could have elevated blood pressures that they couldn't identify, and this also led to maternal deaths and also perinatal deaths.
The lack of safe and timely transport is closely tied to maternal health outcomes. Health workers in the area report that some women die simply because they cannot get to care quickly enough. For some of the riders, the work is personal.
Fortunately, the program came, and it was, I was told, and I came and applied for the job. Being that I was taken, I felt that I was given that opportunity to save babies that dies before they get to the hospital.
The most recent national figures from UNICEF show over 5,000 women and about 30,000 newborn babies die each year in Kenya due to preventable causes during pregnancy and birth. Initiatives like BODA Girls may not be a full solution, but for the women who use them, the presence of a trusted rider at the right moment can mean the difference between life and death. Africa Bureau, WION, World is One.